Right, I'm Richard White. I'm a head and neck surgeon here at James Cook University Hospital in Middlesbrough.
The Look Ahead Cancer Campaign is a voluntary sector group established to try and promote awareness amongst the population of Teesside and the Tees Valley and its surrounds in County Durham in terms of early presentation, the symptoms that people should be looking for, and to try and get head and neck cancer patients to present earlier.
Okay, go again.
Hello, I'm Pam Cooper and I'm Treasurer and Secretary of the Look Ahead Cancer Campaign. The campaign started about 1999, but we became a formally constituted group in 2007.
I'm Shane Lest. I'm an ENT consultant specialising in head and neck cancer at Darlington Memorial Hospital and James Cook University Hospital. Head and neck cancer, the most common type is squamous cell carcinoma, which affects the upper airway digestive tract, and that means from the mouth, tongue and voice box all the way down. That's about 80% of head and neck cancers, and other types of head and neck cancers that are less common are lymphomas, which might present as a lump, just a lump in the neck or a lump in the back of the throat, and salivary gland and nose and sinuses, so a lump here at the angle of the jaw under the mouth, or a cancer coming from the mid-face.
When I worked in public health in Teesside, and I was approached by one of the consultants in ENT who was concerned about people coming in with head and neck cancers quite late, so the treatment was difficult and the survival was less likely. And what he wanted to see was greater awareness really amongst both the public and professionals about head and neck cancers. Because this kind of cancer, I'm sure you'll appreciate, is not as well known as cancers like breast cancer, lung cancer and so on. So it was about making people more aware of this type of cancer and also of the early signs and symptoms.
It depends on where you have the cancer as to which symptoms you have. If you have a cancer in the front of the mouth, you might have a loose tooth, you might have a patch on the tongue, which might be white or red, it might be painful or painless, you might have an ulcer which hasn't healed. Further back, there may be a lump on the tonsils or on the soft palate or on the base of the tongue, and those may cause bleeding, pain, difficulty swallowing or painful swallowing. If the lump is around the voice box, then you can have an altered speech, so hoarseness. You may have difficulty breathing as this airway becomes blocked. It may become, breathing may become noisy. Or you could have, if it's in the sides, you may have difficulty swallowing or painful swallowing. Finally, you may have just a lump anywhere in the neck, and that might be the only sign of head and neck cancer. There's, for the squamous cell carcinoma, which is the most common type, there are two main avenues of treatment, and it depends on the stage and the site as to which is most appropriate. One level of treatment is surgery, and again, depending on the stage and the site, it would depend on how that would be approached. Sometimes it's minimally invasive, so all done on the inside, and sometimes it requires the cut in the neck. The other type of treatment is radiotherapy or chemoradiotherapy, which are both very good treatments but don't involve any surgery. A GP will generally consider a symptom significant if it's been going on for 3 or 4 weeks. The other thing that you could do is see your dentist if it's to do with the tooth, and again, dentists are trained to recognise signs of head and neck cancer. Either those healthcare professionals will refer you up to a head and neck specialist in the hospital and on what's called the 2-week pathway, and you'll be seen within 2 weeks for investigations. Investigations would involve looking at the area that's a problem, such as the mouth or the feeling of the neck, and examining the back of the throat with a fibre optic nose endoscope. This would go into the nose to look at the voice box. It takes about a minute, it's not particularly painful, and it allows the specialist to see the voice box and the air around the back of the throat and see if there's a lump or anything to be worried about. Further investigations will then be planned depending on what was found. Women are also getting head and neck cancer. There's also a new group of patients who we're recognising. It's on the increase, and this is a group of younger patients from the 30s and onwards who will present with a head and neck cancer, usually in the back of the throat or the base of the tongue. And this is associated with HPV, which is human papillomavirus, which causes warts and cancers elsewhere in the body. And This is transmitted through sexual activity and possibly through open mouth kissing, and as such lots of people have it and don't know they have it. So that means there's a younger group of fitter, non-drinking, non-smoking patients who can also be prone to head and neck cancer.
That's good.
Well, what we're hoping to do in the very near future actually is to turn what is a voluntary group into a charity, because we think in that way we can attract more attention and we can raise more funding.
My aim would be really to try and raise money for the organisation, for a campaign. Well, I've thought about doing sponsored walks, and I've also already contacted Vauxhall Car Company, who have the same logo, which is a giraffe's head, as our campaign. So I rang her and said, would you be willing to give any money to this organisation? She said, are you a registered charity? I said, no, but in the future we will be.
You may have seen our posters. They've been in doctors' waiting rooms and dental waiting rooms, and we've had a campaign on the buses, and it summarises all the head and neck cancer symptoms: a mouth lump, a mouth ulcer, hoarseness, pain in your throat, swallowing problems, or a lump in your neck. And if you have any of these symptoms for more than 4 weeks, you can see either your GP or your dentist. And if you need any more information, the head and neck info website is the Look Ahead's website, and you can come and visit us there.